to indulge in certain cosmetic procedures, but how much do you really know about the person performing them? NBC's senior investigative correspondent Cynthia McFadden took a look at what some are calling Dr. Drip. Cynthia, good morning.
Good morning, Savannah. Good morning, everyone. A growing number of family practice doctors, even dentists, are getting into the lucrative business of aesthetic or cosmetic medicine. They take weekend courses to learn how to inject Botox, do chemical peels, and use lasers. But dermatologists and plastic surgeons across the country tell us all too often they're having to fix botched results. 57-year-old Stephanie Gelser wanted to look great in the pictures with her first grandchild.
I wanted to just spruce up a little bit.
So she decided to get a little Botox at the Silhouette Med Spa in Livermore, California. While she was there, the staff encouraged her to try other services as well.
I did have a little spot on my cheek, a little teeny red bump. Yeah, it was pretty small.
Dr. Tam Nguyen, one of the owners of the spa, said he could fix the spot and get rid of 2 veins on her temple.
So he said, I'll do all 3 for $200.
What she didn't understand was that Dr. Nguyen was a family practice doctor, not a licensed dermatologist or plastic surgeon. He's one of an increasing number of family practitioners, gynecologists, even dentists, taking weekend courses similar to this one to expand their practices to include cosmetic procedures. Why? Some say it's about the money.
So by adding chemical peels and microdermabrasion, you can triple your revenue per patient per year.
But sometimes, according to dermatologists, a handful of weekend courses just isn't enough. This is what Stephanie's face looked like 10 days after the procedure.
It was a traumatic experience.
Your face was a mess.
Yeah, for 3 weeks I didn't leave the house.
Dr. Nguyen's office agreed to refer her to a dermatologist, Dr. Jerome Potoskin. He examined Stephanie and says Dr. Nguyen should never have injected her face with the chemical he used.
The procedure is called sclerotherapy. It's used most commonly for leg veins.
He says the side effects for injecting the face with this chemical can be severe, including even blindness.
This requires to be done by the experts of the experts.
And that wasn't Dr. Nguyen. Dr. Nguyen said he'd been to 6 workshops or conferences that ran from 2 to 4 days long and participated in 2 other one-day laser courses.
Be careful with their prescription.
Yes. He agreed to meet with us at his spa.
When I'm here, I call them client.
You do? Here are your clients?
Yes, and sometimes when I treat the diabetes, they're patients.
He told me there's no reason aesthetic medicine should be limited to dermatologists and plastic surgeons. As for Stephanie... So what happened? What went wrong?
So my best estimate is that the agent got outside with the lesion.
It seems to me to be clearly a mistake.
Not necessarily. Just because a bruising occurred doesn't mean that it's a mistake.
So you stand behind the work?
I do stand by that.
And you think that the seminars that you've attended provide enough training to be able to do these really tricky procedures on people's faces?
So it's the same training that even dermatologists get after they graduate.
That's misleading, says Dr. Potoskin. After graduating from medical school, dermatologists must have 3 years of intense training.
You don't learn this in a weekend.
When we asked Dr. Nguyen about his online bio that said he had lectured at the American Academy of Dermatology...
I presented a poster there.
They say they don't have any record of you actually lecturing there.
Yeah, so it's not a lecture, it's a poster presentation.
After our interview and a cease and desist letter from the American Academy of Dermatology, Dr. Nguyen took down the reference to his lecturing at their conference. As for Stephanie Gelser, the scar on her face is almost gone, but the emotional scars, she says, remain.
Don't make my mistake. Don't do what I did. Be smart. Do your homework. Check out exactly what's being shot into your face.
And who's doing it? Dr. Nguyen told me that he's not doing it for the money, but rather to help people. And the dermatologists, well, they're just upset that he and others like him are taking patients away from their business. The bottom line, Dr. Nguyen isn't doing anything illegal, but critics say he is misleading patients and putting them at risk.
She's like she wasn't blind.
Yeah. Well, I mean, it's pretty healed, but you gotta know what's going in your face and who's doing it.
Yeah.
Good advice, I think, in general. Yeah.
Well, you don't want to follow the pilot who's taking a few weekend courses, right?
Cynthia, thank you very much.
My pleasure.
All right, now part 2 of our